beautiful day. Make a difference today. And smile like me this way. Today's episode is all about the port. This is a port. It is a small device placed under the skin and attached to the central line. Medicines and nutritions can be given and blood samples can be taken through the port. The central line. It's a special tube put into a large vein in the patient's upper chest. It is used to give medications, fluids, or blood products, or to take blood samples. This is the needle. It is inserted through the skin into the port to draw the blood or give fluids. My port is right here and it's placed under my skin. Hi, Auntie Diana. How are you?
I'm good. How are you?
I'm good. Thank you for joining me on this video. Can you share with people watching a little about yourself?
Sure. My name is Diana, and I have asked Avila some advice about her cancer journey because I myself have recently been diagnosed with breast cancer. And one of the things that Avila and I will have in common is the port placement. And the port placement is, it's a little device that goes under your skin so that the doctors and nurses can administer the chemotherapy medicine easier than having to go through your vein. So that's my little history. So I wanted to ask Avila about her experience with port placement because I'm a little nervous about getting mine, and I just wanted to get her feedback on what it's like and what her experience was.
I heard you had some questions for me.
Yep, I would like to know, first of all, is it scary?
Yes.
Okay, so I will pray for and ask God for courage so I don't be scared. My next question is, does it hurt a lot to have the port put in?
You go to sleep
Okay.
and give you pain medicine if you're at radies, so it doesn't really hurt.
Okay. So you don't feel it when they put it in?
Mm-hmm.
Okay. So how about after the port is in? Like, how would I take care of it? Do I have to put any special anything on it, or is it hard to take care of?
Just be careful and don't do anything risk-worthy about your port.
So no like chest bumps or squeezy hugs?
Mm-hmm.
Okay. How
Right.
about, oh yeah, you got yours right there. Cool. So I think I'm going to get mine around the same place. Hopefully it'll not be, too painful or too cumbersome. But what kind of, do they put medicine on it before your chemo, or how do they use it? How does it work?
So first of all, they put a needle in,
Mm, I don't like needles.
and then they put some numbing cream on it.
Oh, I like that.
Well, first of all, they put numbing cream, then they put the needle after 30 minutes, and then they put the sticker on, which it helps you protect it from anything.
So like germs or anything
Getting
getting inside of it.
infected.
Oh, okay. That's a good idea. Like a big Band-Aid.
Yes.
Oh, okay.
But there's like this clear wrap around the port so it doesn't get infected.
Oh, okay. That's good to know. Is there anything else in terms of taking care of it that I need to know or that you can advise me?
You have to be careful when you take showers. Don't be
Okay.
like too hard.
Okay.
Just be a little bit softer when you take like showers.
Okay. And when I get the chemotherapy, do you feel when the medicine goes inside the port or you don't feel it?
Sometimes you feel it, sometimes you don't.
Oh, okay. So I guess it just depends on what medicine you're getting.
Hmm.
Okay. Very good. Well, you have eased my mind a lot and answered most of, I think, all of my questions that I had about getting my port inserted. I'm going to have that done very soon. And so I will think about what you said and do what you recommended.
Thank you for joining me on this video.
You're very welcome. Thank you for having me and for answering my questions. And I feel so much better now knowing that, the process of what's going to happen. And most of all, I will pray for courage and strength.
Thank you.
You're very welcome.
So when she is accessed, we cannot get her port or anything wet. And so what the doctors give us is a shower shield, a huge one, and as you can tell, it covers a significant area. And so you put the shield on her, and then you use this tape around the shield, so it's like triple layer of protection to keep her port that is being accessed from getting wet, because you don't want any infections to happen. Now, when her port is deaccessed, meaning she doesn't have an active needle in her, and it's just really all it is like a bump on her skin, the precautions that we take is obviously she can't have any like contact sports. She does need to make sure she's not rough housing. So if you have like younger kids that like to run around and rough house and they have a port, you can't really do that because it is connected to a major artery and you don't want that to be pushed around anywhere, right? So there are definite precautions and things to look out for. But for the most part, like, she's able to run and jump and have fun. She does ride her bike.
Good. Hit it over his head. Okay, two more. Then we're done. Good.
Money